Have you ever stood up quickly and suddenly felt lightheaded, maybe a little dizzy, like the room tilted for just a moment? For many people, it passes in seconds, but for some, it's a warning sign. Low blood pressure when you stand up, what doctors call orthostatic hypotension, can lead to fainting, dangerous falls, and sometimes reveal health problems you don't want to ignore. Welcome to the channel. I'm a consultant physician working in the UK. In this video, I'll show you why you must check your blood pressure standing up, what the numbers really mean, how to measure it properly, and the simple steps that can help you avoid dangerous drops. When you're sitting or lying down, your body isn't fighting gravity. Blood is spread evenly, your heart pumps steadily, and pressure stays stable. But the moment you stand, gravity pulls blood down into your legs. That means less blood returning to your heart, and unless your body compensates, your blood pressure falls. Normally, the body reacts instantly. Sensors in your arteries detect the change. Your heart beats a little harder, your blood vessels tighten just enough, and pressure stays the same, or even rises slightly. That's the healthy, normal response. But if instead your pressure drops, especially by more than 20 points in systolic, the top number, or 10 points in diastolic, the bottom number, within the first 3 minutes of standing, that's abnormal. That's orthostatic hypotension, and it's linked to dizziness, blackouts, falls, and even higher long-term risks of stroke and heart disease. It's not only older adults. Yes, age weakens this reflex, but medicines make it far more common. Blood pressure tablets, like diuretics, alpha blockers, or beta blockers, all lower pressure in slightly different ways. Their benefits are real, they save lives, but here's the catch. The benefits take years to add up, preventing strokes, heart attacks, kidney damage. The side effects, they can happen on day one, feeling lightheaded, dizzy, even fainting. Those can appear immediately, and unless you measure your blood pressure both sitting and standing, you'll never know if treatment is pushing you into dangerous lows. So how do you do it correctly? Here's the method doctors use. Step 1. Rest. Sit or lie quietly for at least 5 minutes. Keep your arms supported at heart level. Take your first reading. Step 2. Stand up carefully. The moment you're upright, the timer begins. Step 3. Take another reading at 1 minute. Step 4. Take a third reading at 3 minutes. Now compare. If your systolic drops by 20 points or more, or your diastolic drops by 10 points or more, and especially if you feel dizzy, that's significant. What's normal? A slight rise, or no change at all. What's abnormal? A sudden fall, particularly with symptoms. Keep your arms supported at heart level, even when standing. Don't clench your muscles, cross your legs, or talk during the test. And most importantly, if you feel faint, stop. Sit down immediately. Don't risk collapsing while you're measuring. Let's imagine you've done the test. What should you make of the numbers? If your blood pressure is stable or slightly higher when standing, that's a normal response. If it drops by less than 10 points and you have no symptoms, usually not concerning, especially if it only happens occasionally. But if it drops by 20 systolic or 10 diastolic and you feel dizzy, blurred, or nearly black out, that's orthostatic hypotension. It needs medical attention. Remember, it's not just about the numbers. A modest drop can still be important if it makes you feel unwell, and sometimes people with bigger drops feel nothing, but that doesn't mean it's safe to ignore, especially if you're older, on medication, or living with conditions like diabetes or Parkinson's. Most people never think about what their blood pressure does while they sleep, but it should dip at night. That's part of your body's natural rhythm. If your pressure doesn't dip, or worse, rises at night, that's linked with a higher risk of stroke and heart attack. That's why some people benefit from taking their tablets in the evening. It lowers nighttime readings and prevents the early morning surge, which is actually the most dangerous time for heart attacks and strokes. But here's the key point. Blood pressure isn't static. It changes with posture, with time of day, and with what you're doing. That's why doctors sometimes recommend 24-hour ambulatory monitoring, wearing a device that checks your blood pressure throughout the day and night to give the full picture. So what can you do to reduce those dizzy spells when standing? Take your time. Don't jump up suddenly. Sit on the edge of the bed first, then rise. Stay hydrated. Low fluids make drops more likely, especially in hot weather. Avoid too much alcohol. It dilates your blood vessels and lowers pressure. Flex your legs before standing. calf pumps, marching in place, anything to keep blood moving. Review your medications. Some blood pressure or Parkinson's drugs can worsen standing lows. A doctor may adjust the timing or dosage. Consider compression stockings. They reduce blood pooling in the legs. Don't skip meals. Big heavy meals can trigger drops afterwards. These simple lifestyle changes can make a huge difference. Not every dizzy spell means something serious, but there are times when you should get checked. If you faint or nearly faint when standing, if dizziness happens often, especially in the mornings, if the drops are new since starting medication, if they're joined by chest pain, palpitations, or neurological symptoms, or if you live with conditions like diabetes, Parkinson's, or nerve disorders that affect blood pressure control, doctors can do more tests, adjust your medicines, and sometimes uncover hidden causes, from dehydration to heart rhythm issues to adrenal problems. So don't ignore it. We often think of blood pressure as a single number, measured once, sitting in a chair at the doctor's office. But it's far more dynamic than that. It rises and falls with posture. It changes with your activity, your sleep, your stress, even the weather. By checking both sitting and standing, you get a clearer view of your health, and sometimes that extra 2-minute step is the difference between catching a problem and missing it completely. So, should you check your blood pressure standing up? Yes, at least occasionally, and definitely if you ever feel dizzy, lightheaded, or you've just started a new medication. Remember, a healthy body keeps blood pressure steady or slightly higher on standing. Drops aren't normal, and if significant, they carry risks. Side effects can appear instantly, even if the benefits of treatment take years. Simple steps, hydration, slow standing, adjusting medication timing can protect you. And if in doubt, speak to your doctor. Your blood pressure is more than just a number in a clinic. It's the story of how your body handles gravity, time, and life itself. Checking it standing up could give you insights and protection you never knew you needed. Thanks for watching right to the end. If you found this helpful, share it with someone who takes blood pressure medication. It might just prevent a dangerous fall. And if you want more clear, evidence-based health advice, click the video appearing on your screen now. Don't forget to subscribe. It helps support the channel and it means you won't miss future uploads.